My name's Neil Fenn. I'm a consultant neurological surgeon at Swansea Bay University Health Board and HMT Sancta Maria Hospital in Swansea. I have a specialist interest in Uro-Oncology, mainly prostate and kidney cancer. So if your general practitioner is worried about the initial investigations, as we mentioned, you'll be referred on for an assessment. And whether this is in the NHS or at the Sancta Maria, you will be plugged in to the same diagnostic pathway. This will involve a review with a consultant urologist. They will go through your history, also review the tests that have already been done, and probably repeat the digital rectal examination. Historically, if there was an abnormality, you would have proceeded directly to a biopsy. That has changed fairly dramatically with the development of a special type of MRI scan of the prostate called a multiparametric MRI. This is where you have 4 separate scans all done at the same time, and they will look at the internal structure of the prostate. And if an area of importance is identified, the radiologist will look at the 4 scans, and if the same area is identified as you go through the different scans, it accrues points and it's more likely to represent an underlying cancer. Happily, the majority of these scans are normal, and we're able to reassure patients that the marginally elevated prostate blood test, for instance, is of no concern. Whereas those people in which we identify an abnormal area, instead of doing random biopsies throughout the prostate, we're now able to target our biopsies to that specific area, which will improve the sensitivity and specificity of the biopsy process. So if there is an obvious abnormality on the MRI, I've mentioned that you'd proceed on to do a prostate biopsy. A biopsy is where we take small samples from a specific tissue, in this case the prostate, so they can be provided to the pathologist to have a look at under the microscope. A prostate biopsy is just a day case procedure under local anaesthetic. Involves an ultrasound probe being placed into the back passage so we can view the prostate, and then needles take cores of tissue, and this can either be done transrectally or transperineally of the area of concern that's identified on the MRI scan. Those biopsies are sent off to the laboratory. The pathologist will arrange for them to be stained and looked at, and we normally have results within 10 working days to either confirm or refute whether there is an underlying abnormality within the prostate. If there is, then we will discuss those results with you. In some patients, depending on what the biopsies actually show, further staging investigations may be required, such as a bone scan or a CT scan, or a PMSA PET scan, which is a relatively new type of scanning procedure, which is particularly good for prostate cancer in certain situations.